Vadim Pokrovsky, chief researcher of the Specialized Research Laboratory for Epidemiology and Prevention of AIDS, announced new data on the spread of the HIV infection rates in Russia. According to him, the first stage of HIV epidemic is observed in 9 regions of Russia. The third stage is generalized, in which more than 1% of pregnant women in 27 regions of the country are infected.
9 of our regions have initial stage. They are mostly small national republics, 48 concentrated stage, that is at least 5% or even more drug addicts are infected with HIV there. And in 27 regions there is a generalized stage. Vadim Pokrovsky, head of the Specialized Research Laboratory for Epidemiology and Prevention of AIDS, Central Research Institute of Rospotrebnadzor at the Infectious Diseases Congress.
According to infectious disease Dr. Sergei Voznesensky, half of all registered deaths in Russia from infections are caused by HIV.
According to Federal State Statistics Service, HIV accounts for 50% of deaths from all infectious pathologies. That is, half of all those who die from infections die from HIV. Another relevant figure is that 10% of all prisoners are infected with HIV. Sergei Voznesensky, Associate Professor of the Department of Infectious Diseases at the People's Friendship University of Russia, in an interview with Izvestia.
Some of the HIV-infected prisoners are now at the front line in Ukraine, including as part of the Wagner private military company. According to the captured Russian mercenaries, when they are wounded, they do not receive proper medical care in the temporarily occupied territories.
We are all treated together, both healthy and unhealthy. I was a carrier of the HIV infection.
Were there any warnings? Have you been isolated somehow?
There were no separate treatments.
That is, your blood could get to a healthy person too?
Yes.
Even the State Duma began to talk about the fact that the rate of HIV spread in Russia is growing, but according to the Russian deputies, the population should take care of the protection measures on its own.
What measures can be taken to limit the spread? Action can only be taken by the people themselves. HIV infection is transmitted in most cases sexually. Accordingly, we are talking about the sexual behavior of people, the use of protective equipment in the form of condoms, the number of sexual partners. There are extremely rare cases where HIV is transmitted otherwise. Sergei Leonov, Deputy Chairman of the State Duma Committee on Health Protection, in an interview with Lenta.ru.
Russia has occupied a leading position in the list of countries with a growing number of HIV-positive citizens over the past 10 years. At the end of 2021, the UN included Russia in the top 5 countries in terms of the spread of HIV. According to the project coordinator of the Eurasian Coalition on Health, Rights, Gender and Sexual Diversity, Nikolai Lunchenkov, the reasons for this are ignoring the problem and corruption in the Russian Ministry of Health.
This is the complete absence of a state prevention program. The prevention program that exists is not scientific, scientifically unsustained method only. Only 5 or 6 countries in the world deny the effectiveness of substitution therapy for people who use drugs, an incredibly effective method of HIV prevention. These are corrupt drug procurement systems. This is absolutely illiterate work with communities of people, representatives of key groups.
According to Nikolai Lunchenkov, international programs to prevent the spread of infection have not been working in Russia for more than a year. No money has been allocated for prevention and support for non-governmental organizations that work in this area. Reported by Diana Kolesnik, Natalia Bilokudra, Evgeny Karmazin, UATV News.